درود به مردم شریف ایران. من شهریار افشار هستم، میزبان شما در برنامه Politics 365. امروز یک ایرانی خیلی فعال در یه وکیل به برنامه دعوت کردیم. خانم نادیا فرجود مقیم سندیگو هستن و یک کاندید هستن برای هلث بورد که حالا به اون گفتگو میرسیم. اما قبل از اینکه به اون گفتگو برسیم واقعا یک لحظه بعد بذاریم کنار برای حوادثی که ما متاسفانه شاهدش هستیم در اسرائیل. تمام واقعا فکر و ذکر و قلب ما با مردم اسرائیل و با تمام ایرانیایی که شاید تحت اثر این واقعا حوادث قرار گرفتن. وقتی من یادم چند سال پیش وقتی تو ایران خیلی حوادث وحشتناک اتفاق افتاد، تمام دنیا گفتن ما ایرانی هستیم. وقتی یه تروریست اتک تو فرانسه اتفاق افتاد، همه گفتن ما فرانسوی هستیم. و واقعا امروز میشه گفت ما همه کلیمی هستیم، we're all Jewish. واسه اینکه حوادثی که تو واقعا اسرائیل افتاد واقعا دردناکه، قابل توجه همه دنیا هستش و هیچ ربطی به موضوع سیاسی که شاید فلسطین با اسرائیل داشته نداره. واقعا یه تروریست اتک و ما توجه کنیم واقعا چیکار میتونیم بکنیم که این حوادث رو دیگه شاهدش نباشیم و تا اونجا که میتونیم به مردم ایرانی که و تمام مردم اسرائیلی که کمک نیاز دارن کمک کنیم. خلاصه اون متاسفانه هنوز شاهد این مسائل هستیم و هر روزم یه حوادث وحشتناکتر متاسفانه باید شاهدش باشیم در CNN و اخبارهایی که میبینیم. خلاصه موضوع خیلی دردناکیه و ما واقعا قلبمون با مردم اسرائیل امروز. من فقط میخواستم این مدت تو این صحبت رو بذاریم برای یه روز دیگه و من مطمئناً با چند تا صاحب نظر و اکادمیک و سیاستمدارایی که در این زمینه صاحب نظرن میخوام مصاحبه کنم و به توجه شما برسونم. اما تا اون موقع فعلا بیایم بریم دنبال اصل مصاحبه امروز که با خانم نادیا فرجود هستش و واقعا یه ذره بیشتر با ایشون آشنا بشیم. ایشون کاندید هستن، گفتم، برای بورد هلث بورد تو سندیگو و یکی از دلایلی که میخواستم با ایشون مصاحبه کنم اینه که میخواستم بیشتر آشنا پیدا کنیم نه تنها با سابقه ایشون اما با هدف ایشون که کاندید شدن برای این آفیس چیه. و واقعا شما که اگرم شنوندگان و بینندگانی که تو برنامه رادیو ایران و تو آنلاین به برنامه ما نگاه میکنن، شما مگه میخواستین کاندید بشین، راهش چیه، چیکار باید بکنین؟ ایشون سعی میکنن یه راهنمایی هم بکنن که اگه شما میخواین کاندید بشین تو هر دیستریکتی، تو هر شهری که شما هستین، راهش چیه و توصیه میکنن که تا اونجایی که میدونید منم که از نظر یه خدمتکار عمومی، یه پابلیک سرونت برای 25 سال میتونم بگم که واقعا پابلیک سرویس در هر جایی که شما بتونین شرکت کنین، سکول دیستریکت، هلث بورد، شهرداری، خیلی هم ایرانیا میدونیم که تو شهرداری مختلف فعالن، تو استیت اسمبلی، واقعا یه کار خیلی لذت بخشیه. شاید دنیا رو نتونین عوض کنین و دنیایی که مثلا الان متاسفانه شاهدش هستیم نتونین عوض کنین، اما تو اون دیستریکت، تو اون شهر، تو اون استانی که شما زندگی میکنین، مطمئنا اگه شما بخواین کاندید بشین و موفق بشین و داوطلب بشین برای خدمت عمومی، پابلیک سرونت بشین، به اون استان کمک میکنه. و هر یک ایرانی که تو این زمینه ها شرکت کنه واقعا هممون میاره بالا. فرقی نمیکنه تو کدوم استان باشین. هر ایرانی که تو این آمریکا و واقعا کشورهای دیگه بخواد تو کارهای پابلیک سرویس بره یا کاندید برای یه نقش سیاسی یا پابلیک سرونت بشه، کارمند برای دولت‌های مختلفی که به کامیونیتیشون خدمت میکنن، اونا همه مهمه، اونا عزیزه و میتونین کامیونیتی خودتون رو بهتر کنین. خلاصه من بخواستم فقط این توصیه رو بکنم که پابلیک سرویس واقعا یک شغل خیلی عالی هستش و میدونم خیلی از ایرانی‌ها که من باشون تو این 25 سالی که من سابقه داشتم توی پابلیک سرویس تماس دارم، اونام لذت میبرن و اونام تونستن که کامیونیتی خودشون رو، شهر خودشون رو بهتر کنن با شرکتشون، با جوری که به شهرشون کمک میکنن. خب نادیا فرجود، خیلی خوش آمدید دوست عزیز به برنامه. We're gonna switch to English. گرچه نادیا خانم کاملا به فارسی مسلطه، این با انگلیسی شاید راحت تر بشه گفتگومون و ترجمه هم کمتر میکنم. و میتونیم برنامه رو به انگلیسی ادامه بدیم. Nadia, my
Abby.
friend, welcome to our program. Please tell us a little bit about your background, your education, and what led you to decide to run for this particular office in San Diego.
Sure. So I was raised in San Diego, California. I'm the daughter of a nutritionist who started off her career in the Women, Infants, and Children program, which is currently, some of you may have heard, is under attack by by recent discussions at the federal level for funding. And it's a really important program to support women and children in getting the nutrition that they need. So I've always been interested in health, and my dad is an immigrant to this country, like so many in the East San Diego County area that I live. Like many who may be listening, came to the United States in 1979 following the Iranian Revolution at age 17 and created his life here. My parents both met at Iowa State University, and then we moved. Our family moved to Chicago and a little community, Naperville, where I was born. And I ended up going to Harvard College to study government. I've always been interested in public policy and politics and how decisions made by our elected officials influences our lives. As you mentioned, Shahryar, at the local level all the way up to the national level, there's ways in which decisions that our elected officials make influence our day-to-day life, from the communities in which we live, how cities are planned and structured, and also the health and wellness programs that are available to community members. And so I decided to pursue, after going to Harvard College, studying government. I was very interested in representation theory and the importance of, and my focus was on women and people of color pursuing elected offices in the United States, and worked at a nonprofit called Political Parity for a couple of years, where I traveled across the country encouraging women and minority women, especially at the local, state, and federal office levels, to consider running for office to represent their communities. There's so many times where you see a woman who's very involved in the PTA, and you go to her and she's done it for maybe something like you, Shahryar, 25 years. And she says, oh, I don't think I'd be cut out for school board. You basically run the community, right? And so encouraging these people to step up and lead because their service would be so valuable. After that experience, I decided to go to law school. I've always loved critical thinking, speaking, engaging with clients, and working with people. And so I became a healthcare attorney, an advocate. And so my experience includes representing healthcare clients across the country in complex litigation and investigations. And through that, I've developed a deep knowledge of the healthcare industry. I have focused my practice on protecting patients from high healthcare costs, especially in the emergency setting where they can be the most vulnerable. And I've advised hospitals in navigating state regulations and represented the governing board of a major California university system in reporting on and investigating allegations of sexual misconduct in the clinical health setting. So cases involving a gynecologist, and those that ultimately led to justice for victims. So that's a little bit about my background.
Fantastic. Thank you so much. And you glossed over it, but you went to Harvard Law School. I just want to say that. As soon as, I think parents hear that, Iranian parents, they're going to say to themselves, mashallah, barikallah, all these good things. So good for you. So proud of you and what you've achieved in your life. And when you go to law, enter a law career, you could go lots of different ways. You could go through, I don't want to say, personal injury, but let's say personal injury. You could get a corporate law, tax law, all kinds of different ways. But you chose, in essence, I'm going to say, like, public health law, helping minorities, people that women, people that really need more help. So good for you for doing that, and thank you for doing that. Now, you mentioned, this particular district that you're in. Tell us about the structure of this health district. What does that mean exactly? Because health districts might be a little bit less known to people than school districts or city council districts, right? Health districts, explain that to me.
So California has about 70 or so healthcare districts, which are each governed locally by a board of elected trustees who are directly accountable to the communities that they serve. And some of them have different missions and mandates, but a lot of them support, I think 50 or so support rural locations where access to healthcare is limited. And their structure is designed to be responsive to local healthcare needs and are public entities or agencies that provide community-based healthcare services for residents in particular geographic areas. So I'm running for the Grossmont Healthcare District, which is based in East San Diego County. And I'm running because of my background as a healthcare attorney and advocate, and because I believe I have the experience and the empathy, compassion, and the work ethic to make a difference in public health. So this district in particular serves the residents of East San Diego County, and they operate a health and wellness library. They provide grants and sponsorships to local nonprofits. Their annual operating budget is about $6 to $9 million. So these are taxpayer dollars that are going toward community health initiatives, and they support the region's future generations through a health career pathways program at high schools to encourage the next generation to consider healthcare careers and hopefully staying in their communities to serve the patients in the areas where they grew up. And they also offer, which is what makes me really excited, these free health and wellness programs. And there's many healthcare challenges, some at the expanding across the national level, things like fentanyl deaths, opioid overdose, mental health crises, challenges with attacks on reproductive health and women's health. And so these healthcare districts can play an important role in responding to community needs and providing services, education to support the residents of the areas they serve. And what makes the Grossmont Healthcare District somewhat unique is the district board is actually the landlord of the Sharp Grossmont Hospital, the only community hospital in East San Diego County. So I think my background as a lawyer and understanding the relationship created by the lease agreement where it could be particularly helpful. So Sharp Healthcare, which is a nonprofit health entity, runs the hospital, so is responsible for the operations and maintenance, but the board actually owns the hospital. And really it's the community that owns the hospital because it's taxpayer dollars that supported that hospital. So I think what sets me apart here is I really believe that these local offices are deeply meaningful and opportunities to engage with constituencies directly about issues that affect their health and wellness. And I think the millions of dollars that the board receives could be put to really good use by working hand in hand with community to deliver on health and wellness objectives.
Thank you for explaining that. That is, I bet, a little known structure to most people. Like I said, most people understand city council districts, state assembly, congressional districts,
Sure.
school board districts, but health districts, that not so much. Now, these are public wellness or health centers that are state funded. That's where the $6 to $9 million come from.
Oh, the $6 to $9 million comes from local property taxes.
Property taxes,
So
got it.
yeah, individuals who are in the Grossmont Healthcare District, which spans 750 square miles, about 500,000 people live in this particular district, and those funds are used in a variety of ways. So some are used to support the health and wellness library, some are used for community health initiatives. An example of one recently that I thought was quite innovative, and I'd like to, if elected, explore expanding projects like this is the district had recognized, along with the County of San Diego, that rural patients had a high hospital readmission rate, which is not good for the patient. It's not good for the hospital for an individual to be returning to the hospital again shortly after having been discharged. And so a mobile clinic has now been funded whereby a healthcare professional travels to check up with the rural patient who recently left the hospital within a few weeks or so, maybe longer. And they actually, that healthcare professional goes to visit the patient to check up on them along with a firefighter who assesses the perimeter of the home for wildfire risk. And so I thought that was a very creative idea, and we'll see if that intervention ends up working, right? But it's a great way to address a problem, which is high rural patient hospital readmission rates, and also addressing another issue, which is in East San Diego County, there's high wildfire risk, and there's been challenges with some community members and residents even being able to get insurance for their homes. And so because of that risk. And so I like those innovative ideas, and I'd like to explore more of them. And being a young woman in this office too, and I'm excited to soon, in the next few days or so, to be starting a family. I think representation matters a lot. I think having young people run for office is important. I think having young moms run for office is important as well. And an organization has supported me, called Vote Mama, has shown through some research that at the state legislature level, only 5% of state legislators across the country are represented by women who have children under 18. And I think that has implications for the policies that we implement and the focuses that different districts and decision-making bodies have.
It does. Thank you so much for explaining that and that encouragement. In the 3 minutes we have left, more so, I bet, as let's say the Iranian American community in Southern California that is within earshot of KIRN, or they may download it on this program on Spotify, YouTube, on my website, but mostly on KIRN, they'll want to know, like, if they have a complaint, where do they go to, right? So this school health district oversees specific health centers. It's not all medical, all hospitals. It's specific health centers that are under your purview, right?
So it's health and wellness programming, and then there's a library that provides health and wellness resources. So there aren't centers per se, but there is a very strong relationship with the Sharp Grossmont Hospital. But Sharp provides the medical services. Really what this board does is it thinks about the healthcare infrastructure beyond the hospital, because the idea is that, and research has supported that, about 80% of what affects our health and wellness is beyond the provision of medical care or in the clinical health setting. So it's things like, do you have access to healthy food in your community? Do you have mold in your apartment? Do you have a stable job? Those kinds of things. Do you have access to mental health care? Those types of interventions, and thinking about, or even, do you have access to what does your transportation look like throughout your day? Those kinds of things. So the real mission and mandate of the district is to make sure that hopefully you don't have to go to the hospital, right? That's the goal, is if you have a robust community health intervention and infrastructure and support, ways to get resources, are educated on things like nutrition and wellness, and things like chronic diseases like diabetes, how to eat right, those types of things. Hopefully you can maintain a healthy lifestyle. And so that's what energizes and excites me most about this position, is supporting community health beyond the actual provision of medical care. Although of course that's important, and supporting the hospital is exceedingly important.
Right. Thank you for that explanation. So if you have a problem with your surgeon, that's somebody else. But if you are looking for wellness, and I'm speaking with other, to other districts. So I'm talking about, the districts in LA, in Irvine, all the places where there's a lot of Iranian American communities. All I can tell you is from personal experience, having my father visited several facilities. It's really great when we go to a hospital and they have a Farsi interpreter. And some schools, so multilingual, care is really important, and that happens a lot more I've seen it in Irvine and LA, because we have a much bigger Iranian community in those. So they have a full-time, several Farsi. When you call certain hospitals in Irvine, they say +1 for English, 2 for Farsi, and then they go from there. And then they have a Farsi interpreter that comes to your hospital room. Talk about wellness. That is such a big help, especially as our parents and us are getting older, if they have a language barrier. So if I could recommend that to you, if there's any ability to encourage that, that is a sense of peace that you just can't buy, right? To be able to speak with someone that you don't language. We have reach. So I'm going to just plant that seed and help you offline.
No, that's
I
great.
can.
That's great, Shahryar, because it also, you're addressing something that I care a lot about too, which is addressing healthcare disparities. And if you can't get healthcare in a language that you understand, or speak to doctors in a language that you understand, or a nursing staff, that's gonna create disparities in your access
and difficulty. So thank you so much, Nadia, Farjood, for your time, for your passion for this cause. We will keep talking because I really want to help. I mean, this is kind of, I want to say, if I can connect the two, it's health and politics, right? They're related. They're not totally different. Of course, we look at politics and what's on CNN sometimes, but health and politics, we know that because we have on CNN, we have Dr. Sanjay Gupta talking about health all the time. So I know this is important to the community and we should keep talking about it and help people get advanced in their own districts in Southern California, LA, Irvine. And of course, we want to see you successful in your bid. So thank you so much, Nadia, Farjood. We'll talk soon.
Thank you, Shahryar. Thank you, everyone.